What I am about to tell you was never meant to be mainstream, because if it were, the entire heart health industry would collapse overnight. You were taught to fear cholesterol, to chase steps, to exhaust yourself on treadmills, but no one warned you about the most dangerous variable of all, the rhythm between your breaths and your heartbeats. This is not poetry. It is physics inside your chest. There exists a narrow breathing window, measured not in minutes but in seconds, that can force your heart into a state of mechanical protection so powerful that cardiologists accidentally rediscovered it while studying heart failure patients. And then it quietly disappeared. 5.5 seconds. Not 5. Not 6. Exactly 5.5 seconds per phase. When ancient initiates spoke about harmonizing the drum of life, this is what they were encoding. They didn't have HRV monitors, but they had bodies that survived wars, famine, and stress levels that would shatter modern nervous systems in weeks. You, on the other hand, are breathing chaotically, unconsciously, all day long, and every irregular inhale is sending noise into your vagus nerve, destabilizing your heart's electrical timing, like static in a control room. I am telling you this directly because you are already paying the price without realizing it. Low heart rate variability is not a wellness metric. It is a countdown clock. It predicts heart attacks, depression, immune collapse, and sudden cardiac events with terrifying accuracy. Yet no one tells you how easily it can be manipulated once you know the lever. The 5.5-second resonance breath is that lever. It is dangerous not because it harms you, but because it exposes how fragile the system truly is and how little effort is required to override it. When you breathe at this precise rhythm, you are not calming down. You are locking your cardiovascular system into resonance. The same way a bridge can either stand firm or collapse, depending on vibration. Most people live their entire lives never once touching this frequency. Their hearts work harder than necessary, age faster than they should, and fail without warning. You are here because some part of you already knows that effort is not the answer. Control is. And control begins with timing. Now let me show you the danger you are already standing in, even if your doctor says you are fine. Right now, as you sit and breathe without thinking, your nervous system is locked in a state of low-grade emergency. Your sympathetic system is constantly flickering on. Your heart is adapting beat by beat to chaotic signals, and your HRV is shrinking like a warning light you have learned to ignore. This is not stress as an emotion. This is stress as electrical instability. Every shallow inhale, every rushed breath, every unconscious sigh is telling your heart that the environment is unpredictable, and your heart obeys by becoming rigid instead of adaptive. Rigid systems break. Low HRV is not just associated with heart disease. It precedes it, often by years. It shows up in people who exercise daily, who eat clean, who look strong on the outside, but are quietly burning through their cardiovascular reserve. You feel it as unexplained fatigue, sudden anxiety spikes, poor sleep, or that sense that your body never fully powers down. This is your baroreflex misfiring, your vagus nerve undertoned, your heart stuck reacting instead of leading. And here is the part that should scare you. No amount of willpower can fix a rhythm problem. You cannot think your way into coherence. You cannot supplement your way into resonance. The heart does not respond to motivation. It responds to timing. When your breathing rhythm is wrong, your blood pressure waves collide. Instead of sinking, your heart must work harder to push the same volume of blood, and microscopic damage accumulates silently. This is how sudden cardiac events are born. Not suddenly at all, but through years of invisible misalignment. Most people only discover this after the damage is done, when the system has lost flexibility and recovery becomes slow or impossible. I am not exaggerating when I say that continuing to breathe randomly, while knowing this information, is more dangerous than ignorance. Because now you understand that your current state is not neutral. It is actively degrading. The question is no longer whether you need an intervention. The question is whether you will choose a precise one, or keep trusting habits that never address the real problem in the first place. Now we move into the mechanism, because belief without understanding is fragile. And I want you to feel this click at a cellular level. Inside your chest lives a negotiation happening every second between pressure and pulse, between blood moving upward and gravity pulling it down. And the referee of this negotiation is a reflex you were never taught to control, the baroreflex. Think of it as a hydraulic sensor embedded in your arteries, constantly measuring stretch and pressure, and feeding that information straight into your brainstem. This signal then travels down the vagus nerve and tells your heart exactly how much freedom it has to speed up or slow down. When breathing is erratic, this signal becomes noisy. Noise reduces adaptability. But when breathing falls into a very narrow frequency, something extraordinary happens. At approximately one breath every 11 seconds, which is where the 5.5-second inhale and 5.5-second exhale emerge, your breathing rhythm locks into the natural resonance frequency of the cardiovascular system. This is not a theory. It is a measurable oscillation, like pushing a swing at exactly the right moment so it moves higher with less effort. At this frequency, your blood pressure waves and heart rate waves stop fighting each other and begin amplifying one another in phase. The vagus nerve fires more efficiently, the baroreflex becomes hypersensitive, and your heart is suddenly given permission to vary again. This is HRV expansion, not because you relaxed, but because you restored signal clarity. Imagine your heart as an orchestra that has been playing without a conductor, every section reacting late and overcorrecting. The 5.5-second rhythm is the conductor stepping back onto the podium. With each inhale, blood pressure rises slightly, heart rate increases. With each exhale, pressure drops, heart rate slows. At resonance, this rise and fall become perfectly timed, maximizing efficiency and minimizing strain. Oxygen delivery improves not because you take more air in, but because circulation becomes smooth instead of turbulent. This is why people see HRV increases of 100 to 150% within minutes when measured correctly. You are not hacking the heart. You are reminding it of a rhythm it was designed to follow. Ancient practitioners sensed this through internal awareness. Modern labs see it on monitors, and now you understand why the number matters. Change the timing, and the effect collapses. Precision is everything here. Now you earn the right to the protocol, because this is where most people fail, not from lack of effort, but from lack of precision. This is not a calming breath, not a meditation, and not something you casually layer onto distraction. You are training a reflex arc, and reflexes only adapt when the signal is clean. You begin seated or standing with your spine neutral, not rigid, not slouched, because spinal compression dampens vagal signaling before the breath even starts. Your mouth stays closed at all times. Nasal breathing is non-negotiable because the nasal passages regulate airflow resistance and nitric oxide release, both of which stabilize heart rhythm. You inhale slowly for exactly 5.5 seconds, not by force, not by pulling air high into the chest, but by allowing the lower ribs and abdomen to expand as if the breath is inflating you from the inside. The inhale is smooth, silent, and unbroken. like pouring oil, not water. At the top, there is no hold. Holding disrupts resonance. You immediately transition into a 5.5-second exhale, equally smooth, equally silent, allowing the ribs to fall and the abdomen to gently draw inward without squeezing. Your shoulders do nothing. Your face does nothing. Tension anywhere above the collarbones is signal contamination. Internally, your attention rests on the area behind the sternum, not to imagine anything mystical, but to anchor awareness to cardiac sensation so the brain links rhythm with feedback. You do not count aggressively. You count softly, or use a timer tone so the nervous system is guided, not stressed. One full cycle is 11 seconds. You perform this for 5 minutes to begin, no more. Longer is not better at first. The most common mistake is micro-rushing, shaving fractions of a second off the exhale without realizing it. This destroys the pressure wave symmetry and cuts the effect in half. Another mistake is breathing too deeply. Depth increases CO2 washout and destabilizes the system. This is about timing, not volume. When done correctly, you will feel a subtle internal widening, not relaxation, but coherence, as if internal noise drops. That is your baroreflex locking in. Treat this protocol like a laboratory procedure because your heart responds to accuracy, not intention. Now let me give you the timeline, because transformation becomes real when it is predictable. Within the first 60 to 90 seconds of correct execution, your heart rate variability begins to rise, not gradually, but in waves, as the baroreflex regains sensitivity and the vagus nerve increases its firing efficiency. If you were watching a live HRV monitor, you would see wider oscillations almost immediately, a sign that your heart is no longer locked into defensive rigidity. Within 5 minutes, most people experience a measurable drop in resting heart rate, alongside a paradoxical increase in alertness, because the nervous system has shifted from chaos to control, not from stress to sedation. Within the first 3 to 5 days of daily practice, sleep architecture begins to change. Deep sleep lengthens, nighttime heart rate drops, and morning wake-ups feel less like recovery from damage and more like completion of a cycle. This is your autonomic nervous system, relearning how to shut down efficiently. By the second week, baseline HRV trends upward even outside the practice window, which is the real marker of adaptation. This means your heart is no longer dependent on the exercise to function properly. It has recalibrated its default rhythm. Emotional volatility decreases not because emotions disappear, but because physiological overreactions stop hijacking them. Blood pressure variability improves, which reduces shear stress on arterial walls, a silent but critical form of cardiovascular protection. After 30 days, you are no longer practicing a technique. You are inhabiting a different operating system. Your heart works less to do more. Recovery accelerates, and stress no longer imprints itself as deeply or as long. This is how endurance increases without strain, and calm appears without passivity. The most important change, however, is invisible. Your cardiovascular system regains flexibility, and flexibility, not strength, is what determines how long a heart survives under pressure. Now comes the challenge, and I will not soften it for you, because this is where knowledge either becomes power or becomes liability. You now understand that your heart is not failing because you are weak, unlucky, or aging, but because it has been forced to operate without rhythm in a world that never pauses. Knowing this and doing nothing is not neutral. It is a decision to let randomness keep driving a system that demands precision. I am telling you plainly, 5 minutes a day at the wrong rhythm will change nothing, and 5 minutes a day at the right rhythm will quietly rebuild you from the inside out. This is why this breath was never popularized. It does not sell products. It does not require gurus. It requires discipline, attention, and respect for timing. You will be tempted to rush it, to multitask, to turn it into relaxation or entertainment. That temptation is the old system trying to stay in control. Do not negotiate with it. Commit to the protocol once in the morning and once in the evening for 14 days. Measure your resting heart rate. Measure your HRV if you can. Watch what happens. If nothing changes, walk away. But if your heart becomes steadier, if your stress no longer spikes uncontrollably, if your body recovers faster than it did before, then you will know something most people never learn, that the heart does not need to be pushed. It needs to be conducted. Ancient traditions guarded this with ritual. Modern science confirmed it with sensors. You now carry both. The only remaining question is whether you will use it consistently or let it become another forbidden truth. You briefly touched and then ignored. Your heart is listening either way.